Voice is destroyed. So anyway, I come back again. These are all meant for me to encourage myself to read. And if you find it helpful, this material is not mine. I found it on the internet and I'm just using it. So it's not my materials. So I'm just using it to read. And so I just added some of the stuff from the internet too to here. So now we're going to talk about the diaphragm. So the diaphragm, a paralysis of the half and rupture. So these are the two things we're going to talk about them. So here, what we can see is, if we see here, so this is the normal diaphragm. So the normal diaphragm is going to be right here. This is in the front, and then this is in the back. That is how it's going to look around. And this is the lung and the thoracic cavity. So but if during the resting, the diaphragm is going to be right here. So this is where it's going to be. So that is the blue one. But the normal inspiration, so if you breathing in and you pulling the air inside, this is where the diaphragm is going to be. But and this is the red one. When you are inspiring, this is the red one that is going to be. So the diaphragm is going to be lower, and if you are resting, your diaphragm is going to be above. But you are inspiring the air. During the inspiration, the diaphragm is going to pull downwards. Okay. But now now there is a different when there is a pathology, and the pathology is going to be the paralysis of the half of the diaphragm, may result from the injury of the operative division of the phrenic nerve, the operative division of the phrenic nerve, so of the same side. So it's going to be on the same side. So it can be detected radiologically. So during the radiology, you can see this one. You can detect that the diaphragm is not working properly because of the movement of the diaphragm is not working properly because of its movement during the radiology. So the paradoxical movement, this is the dome of the diaphragm of the injured side pushed superiorly by the abdominal viscera. So during the inspiration, instead of the descending, as we said earlier, that this is the diaphragm. If you are breathing, if this is the diaphragm at rest, this is the diaphragm at rest, and this is during the inspiration. So during the inspiration, it's going to go down. Okay. But here, with the people that have the diaphragm that is injured, here look at the diaphragm here. So this is the one at rest. This is the one at rest. Let's say this is the one at rest here. So this is rest, and here the normal one, this is the normal one at rest. This is the here at rest. So the normal one at rest, if you breathe in, so is going to go downwards. So this is during the inspiration. But this one here, if you breathe in, instead of going downwards, is on the contrary, is going upwards. So this is what it is here. So is the dome. So this is the dome of the diaphragm, this area here. So that dome, instead of going downwards, is going to be pushed upwards by the visceral organ. So the abdominal viscera is going to push it upwards. So this is what it is when there is the half, the paralysis of the half, and the rupture. But it didn't say anything about rupture here. So what is it called? It's called paralysis of the right hemidiaphragm. So this is the hemidiaphragm, one half. So because the phrenic nerve is going to come from above, so it's probably get injured somewhere. And that is what is caused this one. Then the next one, we're going to talk about the diaphragmatic rupture. So this is the rupture of the diaphragm. What is the rupture of the diaphragm? Diaphragmatic injuries are relatively rare and result from the either the blunt trauma or the penetrating trauma. So there is a blunt trauma, is something that just push it bluntly, or something that is penetrating that area. So this is recently 80 to 90% of the blunt diaphragmatic ruptures result from the motor vehicle accident. So this is motor vehicle crashes. So the majority of the 80 and then 90% of the blunt diaphragmatic rupture have occurred on the left side. So here is the left side. The left side, so the person is standing here with their eyes looking at you, so this is going to be the right side of the person, this is going to be the left side. So most of them, 80% are going to 80 to 90% are going to happen on the left side. Okay, so the blunt trauma typically produces large radial tears. So this is a large radial tears measuring between 5 to 15 centimeters. So most often at the posterolateral aspect. This is the this is the posterior lateral aspect. This is, remember, this is the same area where there is the herniation in the infants. There is, that is hernia can happen in the infants, that all the contents of the GI here of the stomach will go upwards through the diaphragm and then herniate upwards to where the lungs are. And as you can see, this is the lung here is going to be compressed. So again, so I'm going to say that is a rupture. Most of the time is because of the blunt traumas, or it can be because of the penetrating traumas. So the blunt traumas are 80 to 90%, and most of them will happen on the left side. And on the left side is most of the time on the posterolateral. Okay, so that is the rupture of the diaphragm. Let's go to the other one, which is the cardiac hypertrophy. A cardiac hypertrophy here. What is the cardiac hypertrophy? Cardiac hypertrophy, this is the left atrial enlargement. So this is the atria. So I always draw the thing like this, the heart. The heart has four chambers. This is the atria, and this is the atria. So this is the left atria. This is the sorry. So this is like this. So this is the atria. This is the atria. This is the right atria. This is the left atria. This is the ventricle, this is ventricle, this is the right ventricle, this is the left ventricle. If we do this one here, so this will be the aorta coming out of here, this is going to be the pulmonary artery coming out of here. So what we say that this is the cardiac hypertrophy. Cardiac hypertrophy, this is the enlargement hypertrophy secondary to the mitral valve failure. So no, this is the left atria. So here is the atria. So you're going to come from the mitral valve, you're trying to come down here, but this one area here is stenotic, is stenotic, or is very narrow. So then you're going to push harder, and that will cause the hypertrophy of the left atria. And then so that is the mitral valve failure. And then the compresses on the esophagus. So here we know that the esophagus is on. So here is the heart. Here is the heart here. The heart is located in this way. So this one here, the one in the back, that will be an atria, or the one on the left, that will be an atria. This on the right is going to be an atria. This is going to be the ventricles. This is going to be the ventricles. So this is going to be the left ventricle, this is going to be the right ventricles, this is going to be the right atria. But this is the left atria. The left atria is going to be just in front of the esophagus. And there is here the aorta is to the left side of the aorta. Of the esophagus. This is onto the left side of the esophagus. So if there is an enlargement of the left atria, that will cause the compression of the esophagus, and that is going to be as difficulty to swallow. So it may be observed as a filling defect in the esophagus by the barium. So here this is the filling defect. So we allow the person to swallow the barium, and then you will see that there is a filling defect in this area. So this is the filling defect. So let me see if I can see a better so the esophagus, barium, swallow. Okay, let me do this one. So the filling defect, barium, swallow, and then I can put filling defect. Oh, it's right here. So the filling defect. So let's see if there is pictures. Yes, these are much better. You can see them much better than the other one that we have. So here, look here. So this is where is the one I just saw? Yeah, this is much better. That is this one here. So this is copy the image, and I can copy something else also. So that is the barium swallow. That is everything crashed. So we'll see it again. Let's put it here. Let's put it here. Let's take this one and put it here. Let's put it there. So you can see that is the barium. Because it's better than this picture here. The picture here doesn't show much. So we're just gonna place this right there. So as you can see the barium defect, and then I'm gonna see another one because I am a visual learner, and for me to see the stuff then I remember them. If I don't see, I don't remember. If I don't see, I don't remember. So this is another one here. So the filling defect of the esophagus on the barium meal with a typical proximal and a distal shouldering. What is the shouldering here? I don't know what is it. This is digital and the say proximal and the distal shouldering. Okay, I don't know what does that shouldering mean. So let me just do that one. Maybe I'll see some stuff that are better. Down here, let's see here, let's see here. What do we see? We see another one. This is also a defect, so I'm just gonna copy this defect and then I'll put it here. So to God be the glory. Thank you, God, that I can be awake until 5:15 a.m. to do this. 5:15 a.m. to do this. To God be the glory. To God be the glory. So here it is. Just gonna put it there. So okay, I got this one now. So what is saying that this is the left atrium. The left atrium is enlarged. Is enlarged. Why? Because there is the failure of the mitral valve, and that failure of the mitral valve is going to cause the esophagus to be compressed, and this will cause the difficulty in swallowing. So it be observed as a filling defect in the esophagus by the barium swallow on the lateral thoracic x-ray. So this is the lateral thoracic x-ray. So we need to remember this is the lateral thoracic x-ray. So I'm just going to take this one here and do this one here. This is the lateral thoracic x-ray. X-ray. Okay, the lateral thoracic x-ray. Let me write it in a better way. So this is the lateral, okay, thoracic x-ray. So I'm just gonna put X there so we can see what it is. So this is lateral, this is lateral. So great, I got it. So I got it. So